Hi, everyone. My name is Nick Drust, and I appreciate the opportunity to spend some time with you today. Before we begin, I want to point out that while I work in the healthcare water industry, today's discussion is focused entirely on standards, regulatory guidance, and patient safety, not on any specific manufacturer or product. For the past 4 years, my entire focus has been helping hospitals improve water safety, reduce infection risks, and prepare for the ever-changing regulatory landscape surrounding healthcare water systems. Today, we're going to discuss two of the most important water-related standards released in healthcare in recent years: ANI ST108 and ASHRAE 514. Together, these standards elevate water from a facilities issue to a patient safety issue. So before we jump into the standards, let me tell you a little bit more about myself so you know where my perspective comes from. I've spent the last 4 years working exclusively in healthcare water safety with hospitals throughout the Midwest and across the country. Every single week, I'm either in a healthcare facility, a mechanical room, sterile processing department, speaking with infection prevention, meeting with facilities directors, looking at survey findings, and learning how different organizations are approaching water management. So I get to see what works and, just as importantly, what doesn't. Before joining Nephros, I spent about 5 years working in the pharma and biotech industries. My focus back then was helping companies properly clean and disinfect clean rooms. I understood contamination, sanitation, disinfection, but if I'm being completely honest, I did not know much about water. I think that's actually been an advantage because I had to learn this industry the same way many of us do, by asking questions, visiting hospitals, and talking with engineers and infection preventionists. One thing became very clear to me. Water is one of the most misunderstood utilities inside a healthcare facility. We tend to think if the water looks clean, it must be clean. If it's clear, it's safe. If we've never had a positive culture, we don't have a problem. But the standards we're discussing today challenge every one of those assumptions. That's really why I enjoy giving presentations like this. My goal isn't to overwhelm anyone with technical language. There are people in this room who know way more chemistry than I ever will. There are people who know much more about sterile processing better than I ever will. And there are engineers who understand plumbing systems far better than I ever could. My job is to simply connect all of those pieces together. One of the things I love about ASHRAE 514 and ANI ST108 is that they force departments to talk together and start having conversations. Whether it's facilities, infection prevention, sterile processing, engineering, when these groups work together, that's when hospitals make the biggest improvements. So today, that's exactly how I'd like to approach this conversation. I remember one hospital where a facilities manager told me, "Our water is perfect." 5 minutes later, I went to go speak with an infection preventionist, and they told me, "We're constantly worried about our ice machines." Same building, same water, completely different perspectives. By the end of today's presentation, I would like you to leave with a better understanding of why these standards were created, what they're asking healthcare facilities to do, and how they affect the work you do every day. I would like you to understand 4 things. First, what ASHRAE 514 and ANI ST108 actually require. Second, what water quality parameters matter and why do those parameters matter? Third, how do those standards align with regulatory bodies, including the CMS and Joint Commission? And finally, how water filtration for infection control fits into an overall risk management strategy. So before we get into the standards, I think we have to understand one very simple question. Why does water matter? I think most of us take water for granted, but it's extremely important, and even more important when we talk about healthcare facilities. Water touches nearly every patient, device, and department within a healthcare facility. Despite modern treatment systems, waterborne illnesses still affect millions of Americans every year. Legionnaire's disease alone carries about a 10% mortality rate, and when acquired in a healthcare setting, that number approaches somewhere near 25%. The CDC has found that nearly 90% of Legionella outbreaks were associated with preventable water management failures. The key word there is preventable. Water doesn't become dangerous because it entered the building contaminated. More often, it becomes contaminated inside the building itself. Water can carry all sorts of bacteria and viruses throughout your facility. We're going to deep dive into some of those shortly, and I want to share more about biofilm, various bacteria, and I'm going to point out some blind spots that might be right in front of you every day. This slide is really a visual representation of what happens to water after it enters the building. The city doesn't own the problem once the water enters the hospital. The hospital does. Many healthcare facilities do an excellent job treating incoming water through municipal treatment and in some cases, supplemental secondary disinfection programs. Those measures play an important role in reducing risk throughout the water system. However, once water enters a building, it encounters a complex network of pipes, storage tanks, dead legs, fixtures, and varying temperatures. As water moves through that system, conditions such as stagnation, heat, scale, and biofilm can develop and create environments where microorganisms may persist or regrow. Biofilm is extremely important because it can act as a protective environment for bacteria, shielding bacteria from disinfectants and allowing bacteria to survive within the plumbing system. Many waterborne pathogens, including Legionella, thrive in temperatures between 77 and 113 degrees. Areas such as your recirculation loops, low flow sections of piping, and locations near water heaters are ideal environments for microbial growth. The key takeaway is not that secondary disinfection or water treatment is ineffective. It is that no single strategy can address every risk throughout a building water system. That's why healthcare water management programs rely on multiple barriers working together. Point of use filtration serves as that final barrier at the point of patient care, complementing existing treatment strategies and helping reduce patient exposure to water pathogens at the outlet. I spend every day focused on healthcare water safety. One thing I've noticed is that water-related events are not rare. They happen somewhere in the country every single day. About a year ago, a facility manager told me, and I'm never going to forget this, that no one celebrates clean water, but everyone remembers an outbreak. Some make national headlines, others never do. It might be a boil water advisory, a Legionella case, instrument contamination, an ice machine issue, a positive water culture, or a facility discovering a problem only after a patient or process has been impacted. The common thread is that many of these events originate from risks that were not fully recognized, monitored, or controlled. When I talk about blind spots, I'm not talking about negligence. I'm talking about areas that often fall outside normal attention. Low use outlets, ice machines, dead legs, stagnant piping, processes that may not be included in routine testing or PMs. I'd like everyone to think about one question. Where does water go in your facility after it leaves the main distribution system? And do you have visibility into all those locations? Most healthcare organizations don't struggle with the risks they know about. They struggle with the risks they didn't realize were there. If you look at the bottom right of this slide, you'll see that Legionella is only one of the many organisms that can be present in building water systems. Healthcare water management is really about understanding the entire ecosystem of potential pathogens and reducing risk through a comprehensive multi-barrier approach. This slide often surprises people. When we talk about waterborne pathogens in healthcare, Legionella tends to get most of the attention, and for good reason. It can be severe, it can be deadly, and it often makes national headlines. If you look at the overall burden, Legionella, though, is only part of the story. The CDC estimated that just 4 waterborne infection types accounted for approximately $3.3 billion in annual healthcare costs. What's particularly interesting is that NTM and Pseudomonas represented a larger financial burden than Legionella alone. The takeaway is that we should not worry less about Legionella. It's that healthcare water management programs need to take a broader view of risk. ASHRAE 188 was largely driven by Legionella prevention. ASHRAE 514 expands that conversation to include a wider range of opportunistic waterborne pathogens and a more comprehensive risk management approach. For facilities teams, this means asking, are we only looking for Legionella, or are we managing the conditions that allow multiple pathogens to survive? Because the real impact isn't just measured in dollars, it's measured in patient outcomes, extended lengths of stay, treatment cost, regulatory scrutiny, and operational disruptions. The goal of a water management program isn't simply to prevent one organism, it's to create a system that consistently reduces risk across the entire water environment. I won't spend a lot of time here. These are simply the organizations that drive the standards and survey expectations we're discussing today. The key takeaway is all these groups are moving in the same direction, towards proactive water management. That direction is risk assessment, documenting, verification, validation, continuous improvement. In other words, we're moving away from reacting to water problems and towards preventing them. What do surveyors look for? This may be one of the most practical slides of the day. If CMS walked into your facility tomorrow morning, would you be able to produce every one of these documents within 15 minutes? These are the types of things that you need to be looking at, making sure that you have in place in your healthcare facility. Whether it's a written water management program, it's something that really needs to be followed. You need to have a water management team meeting at least once annually. You need to record your testing results. You need to make corrective actions if you are popping positives, for example. Are your ice machine PM records in place and updated and being recorded properly? Very important. Okay, let's get into some of the exciting stuff. We're going to do this in 2 halves. We have ASHRAE 514, which is your facility risk, and then AMI ST108 on your right, which is really centered around device reprocessing. These are 2 of the most important standards related to water in your facility. It's important to note both of these were published standards and released at the end of 2023, which more work had been done in 2023 than the last 40 years prior to that. These are companion standards. They force multiple departments to talk. Again, whether it's SPD, facilities, infection prevention, engineering teams. We have 514 on your left. It's about 90 pages of information related to physical, chemical, microbial risk in your facilities. This new standard talks about all pathogens in your facility. We're going to start on 514 on your left. We're going to finish up with ST108. which is the title. The title is Water for the Processing of Medical Devices. I think it's very important and share for the very first time in sterile processing departments, water testing is finally clearly defined within that standard. At first glance, it seems ASHRAE 514 and ST108 look like completely different documents. One focuses on building water systems, while the other focuses on sterile processing and medical device reprocessing. When you step back and look at them together, they're actually saying many of the same things. First, both standards are built around identifying risk and implementing controls. Neither standard assumes every facility has the same challenges. Instead, they require us to evaluate our own systems, identify hazards, and determine what controls are appropriate for our environment. Second, both standards are performance-based rather than prescriptive. They don't tell you exactly what technology to buy or exactly how to solve every problem. Instead, they ask a different question. Can you demonstrate that your control measures are effective? Whether it's filtration, disinfection, flushing, temperature management, or some combination of strategies, the expectation is that you can prove it's working. Third, both standards emphasize monitoring and documentation. It is no longer enough to say we have a water management plan. Surveyors increasingly want evidence that the program is being monitored, documented, verified, and adjusted when conditions change. Another important similarity is that both standards recognize filtration as a legitimate microbial control strategy. Not necessarily everywhere in the building, but certainly as a risk reduction tool in appropriate applications in high-risk environments. And finally, both standards make it very clear that water safety is no longer owned by a single department. Not one department can do this alone. Success requires collaboration between everyone, stakeholders, facilities, IP, SPD, engineering, and leadership. So while 514 and ST108 address different parts of the healthcare environment, they're both pushing us towards the same destination, a proactive, risk-based water management program that focuses on patient safety, measurable performance, and continuous improvement. Now we're going to take a closer look at ASHRAE 514 and what it specifically expects from healthcare facilities. I'm going to pause here and pick up in the next chapter.